Welcome to the deep dive. Today we're zeroing in on a really common household hazard for our pets, for dogs and cats. It's antidepressant toxicosis. We're talking about what happens when pets get into medications like SSRIs.
Right.
You know, selective serotonin reuptake inhibitors, and SNRIs, serotonin norepinephrine reuptake inhibitors.
Exactly. And these are, well, they're drugs often prescribed to us humans, aren't they, for things like depression, anxiety, sometimes even migraines.
Yeah.
And they work by basically tweaking the levels of serotonin in the brain. Serotonin, it's involved in quite a lot of bodily functions, actually.
So our mission today is to really dig into what happens when pets ingest these. Often by accident, I imagine.
Absolutely. And, you know, it's surprisingly common. This is actually the second most frequent human prescription medication toxicosis reported in animals.
Wow, second. That's huge.
It really is. And it underlines why, you know, every pet owner needs to be aware of this.
Okay, so let's start with the absolute basics then. What exactly is antidepressant toxicosis in this context with SSRIs and SNRIs?
Well, simply put, it's the harmful effects that happen when a pet gets too much of an SSRI or SNRI.
Right, an overdose.
An overdose, yeah. Or sometimes it's when they ingest these drugs along with other drugs that also ramp up serotonin levels.
Ah, okay. A combination effect.
Exactly. And we're talking about really common medications here, things often found in medicine cabinets, you know, drugs like citalopram, fluoxetine,
Prozac, right?
Prozac, yeah, that's fluoxetine, paroxetine, sertraline too. Those are common SSRIs.
And the SNRIs.
Things like venlafaxine, duloxetine, those are probably the best known ones. Secure storage is just so critical with these.
Definitely. So they're designed to help people, but how do they affect a dog or cat system when they get their paws on them?
Well, both types work mainly by stopping the normal reabsorption, the reuptake of serotonin in the brain.
Okay.
SSRIs are, like the name says, pretty selective for serotonin. They boost its availability. SNRIs do that too, but they also block the reuptake of another chemical, norepinephrine.
Got it. And having too much serotonin just floating around.
Yeah.
That's the problem. I think I've heard of serotonin syndrome.
You have. That's exactly it. When those serotonin receptors get overstimulated, it can trigger this whole cascade of effects.
And what does that look like?
In humans, it's usually a mix of things. Muscle twitching, we call it myoclonus, mental changes, agitation, maybe really exaggerated reflexes, tremors, diarrhea, trouble walking straight, even a high fever.
Sounds serious.
It can be. And what's tricky and kind of worrying for pet owners is that the exact toxic dose for dogs and cats isn't as well defined as it is for people. It can vary.
So, a bit unpredictable then. You mentioned serotonin affects lots of things. Which body systems really take a hit from this kind of toxicity? Can we break that down?
Sure. We see effects across several key systems. The cardiovascular system, so heart and blood vessels. You might see low blood pressure, hypotension, or really fast heart rate, tachycardia.
Okay.
Then the GI tract, the gut. Increased serotonin makes those smooth muscles contract more, which often leads to vomiting and diarrhea.
Right. Definitely unpleasant signs. What about their brain and nerves?
Yeah, the nervous system often gets overstimulated. Think agitation, restlessness, even seizures in bad cases.
Oh, wow.
You might also see mental changes, like the pet seems confused, disoriented, maybe vocalizing strangely. And neuromuscularly, you can get issues with the autonomic nervous system hyperactivity and also that neuromuscular hyperactivity, like those exaggerated reflexes, the muscle twitching, the tremors we mentioned.
And I think you said earlier, even their eyes and breathing can be involved.
That's right. Eyes often have really dilated pupils, mydriasis, we call it. And with the respiratory system, those smooth muscles in the airways can contract more, potentially making breathing difficult. Dyspnea.
Okay, so it really can affect them head to tail. Who typically gets affected? Any breed or age more susceptible? And what's the first thing an owner might notice, that first red flag?
It affects both dogs and cats, really any age. What owners often report first is either sudden agitation, restlessness, or sometimes the complete opposite, unusual lethargy.
Interesting contrast.
Yeah. Also, those widely dilated pupils are a pretty common early sign. Vomiting, tremors too, sometimes excessive drooling, diarrhea, and like I said, in more severe cases, seizures or those rapid flickering eye movements, nystagmus.
And if an owner sees those signs and rushes their pet to the vet, what will the vet likely observed during the exam?
Well, the vet's findings usually line up with what the owner saw. We might see the agitation directly or the lethargy, difficulty coordinating movements, ataxia. Those dilated pupils are often very obvious. Tremors, vomiting, disorientation, a high temperature, hyperthermia, that's common too. Unusual vocalizing, depression, the fast heart rate, low blood pressure, diarrhea. And in the really tough cases, yes, even temporary blindness, seizures, and sadly, it can be fatal.
It really sounds serious. How does this usually happen? Is it always just accidental, like dropping a pill?
Accidental ingestion is definitely the most common way. You know, a pill gets dropped, the dog gobbles it up before you can react.
Happens fast.
So fast. Or maybe a curious cat or dog gets into a bottle left on a nightstand. But it can also happen if a pet is prescribed one of these and maybe gets the wrong dose or too much.
Right, administration errors.
Exactly. Or even just therapeutic use leading to an overdose, though that's less common.
So beyond just putting bottles away, what are some really practical tips for prevention? Specific storage ideas?
Oh, absolutely. Prevention is everything here. Even if you don't have kids, using child-proof caps can deter some pets.
Good point.
Never, ever leave loose pills on counters, nightstands, anywhere accessible. Be super careful when you're taking your medication if pets are around. A dropped pill is gone in a flash.
Sure.
And the gold standard. Store all medications, yours and your pets', in a high cabinet, a locked drawer, somewhere your pets physically cannot get to.
Those are really solid, actionable tips. Now, you mentioned combinations earlier. It's not just about the SSRI or SNRI itself, is it? Things can get worse if other substances are involved.
This is so important, yes. Co-ingestion, taking these drugs along with other things that also boost serotonin, that significantly increases the risk and the severity of serotonin syndrome.
So what kinds of things are we talking about?
Well, older antidepressants like TCAs, tricyclic antidepressants and MAOIs, monoamine oxidase inhibitors, other newer antidepressants too.
Okay.
But also really common pain meds like tramadol, even fentanyl. Some over-the-counter cough medicines contain dextromethorphan. That's a risk. Supplements like 5-HTP or St. John's wort.
Wow, even supplements.
Yes. And things like amphetamines, cocaine, LSD, buspirone, bupropion. The list is actually quite long. It really highlights why your vet needs to know everything your pet might have ingested or is taking.
That's crucial. So thinking about risk factors, who's most likely to have a severe reaction if they do ingest one of these?
Pets already on another serotonergic drug are definitely at higher risk, that combination effect again.
Makes sense.
Also, animals with underlying liver or kidney problems might struggle to process and get rid of the drug, making them more susceptible. And interestingly, there's a specific heads up for cat owners. Cats seem to be weirdly attracted to Venlafaxine, the SNRI. There are reports of cats chewing into multiple capsules.
Oh, that's really specific and concerning for cat owners. Okay, so a pet comes in showing signs. How do vets actually diagnose this? Are there specific tests?
Yeah, diagnosing. It's often based more on the history, like, did the owner see them eat the pills? And the clinical signs. Unfortunately, there isn't a single specific test that says, yes, this is serotonin syndrome.
No blood tests for it.
Not directly for the syndrome itself. Routine blood work and urinalysis might be pretty normal, actually. Sometimes, though, we might see myoglobinuria, that's muscle protein, in the urine.
For muscle damage.
Exactly, from severe tremors or seizures causing muscle damage, rhabdomyolysis, and maybe metabolic acidosis on a blood gas analysis if it's really severe.
What about testing for the drugs, the SSRIs or SNRIs? Can you detect those?
Tests do exist, yes, but they're often not super helpful in the heat of the moment.
Why not?
Well, they can take time to get results back. And treatment really needs to start right away based on the signs we're seeing. Plus, knowing the level doesn't always perfectly predict how sick the animal will be.
Ah, okay.
There is one important quirk, though. Venlafaxine, that SNRI cats seem to like. It can cause a false positive for PCP on some urine drug screens.
For PCP? Wow, that could really throw you off.
It absolutely could if you're not aware of it.
So, if there's no definitive test, how do vets rule out other things that might look similar?
That's where differential diagnosis is key. We have to think, what else could cause these signs? Other toxins are high on the list, like those older antidepressants, TCAs, and MAOIs, snail bait containing metaldehyde, lead poisoning, antifreeze ethylene glycol, even certain types of hops, believe it or not, anticholinergic drugs, antihistamines.
Lots of possibilities.
And it's not just toxins. We also have to consider medical conditions like meningitis, brain tumors, severe overheating like heat stroke, or a condition called malignant hyperthermia.
So it's really about piecing together the history, the exam, and ruling things out. Once you suspect antidepressant toxicosis, what's the treatment plan?
First things first. Immediate vet care is critical. Time matters.
Right.
If the ingestion was very recent, say within an hour or maybe two, and the pet isn't showing signs yet, we might try to make them vomit-induce emesis.
To get the pills out.
Exactly. If it was a really large ingestion, sometimes gastric lavage, basically pumping the stomach, might be done under anesthesia.
Okay. And I know activated charcoal comes up a lot with poisonings. Is that used here?
Oh yes, activated charcoal is a mainstay. It binds the drug in the stomach and intestines, preventing it from being absorbed into the body.
Does it work well?
It does help reduce absorption. We usually give it with a cathartic, something to speed up passage through the gut. And because some of these drugs have a long half-life, meaning they stick around in the body for a while, we might need to give repeated doses of charcoal.
That makes sense. So besides getting the drug out or binding it up, what else is involved in treatment? Supportive care.
Supportive care is absolutely crucial. Usually this means intravenous IV fluids.
Why are those so important?
They help maintain blood pressure, regulate body temperature, and very importantly, they help protect the kidneys, especially if there's that risk of myoglobinuria from muscle damage.
Got it. What about specific symptoms like the agitation or tremors?
Right, we treat the signs. For severe agitation, we might use sedatives like isopromazine or a drug called cyproheptadine, which actually has some anti-serotonin effects.
Okay.
Benzodiazepines like diazepam or Valium are sometimes mentioned, but there's a bit of caution there. Some sources suggest they could potentially worsen serotonin syndrome in certain situations, so it's not always the first choice.
Interesting nuance. And for the tremors?
A muscle relaxant called methocarbamol is often used for tremors and muscle rigidity.
Are there medications that are a definite no-no, things that should absolutely be avoided?
Yes, absolutely. We need to avoid anything else that could push serotonin levels even higher. So no other SSRIs, SNRIs, MAOIs, TCAs, no amphetamines. Also avoid supplements like 5-HTP and St. John's wort, some antibiotics like clarithromycin, cough suppressants like dextromethorphan, lithium, all contraindicated. High risk of making things much worse.
Okay. A long list to avoid. Any others that are maybe lower risk but still need caution?
Yeah, there are others to use carefully. Tramadol, fentanyl, amantadine, bupropion, codeine. They have some serotonergic activity, so we use them with caution if absolutely necessary.
It really sounds like a delicate balancing act, managing the symptoms without making the underlying problem worse. What about interactions if the pet is already on other meds for different issues?
Good question. Yes, there are potential drug interactions. Some drugs, like cimetidine, certain diuretics, quinidine, lithium, can actually slow down how the body breaks down SSRIs and SNRIs.
Meaning the antidepressant levels could get too high.
Exactly. And conversely, SSRIs and SNRIs themselves can slow down the breakdown of other drugs like theophylline, warfarin, Coumadin, digoxin, potentially increasing their levels and risk of side effects.
Wow. So that complete medication history you mentioned is vital for treatment too, not just diagnosis.
Absolutely essential. We need the full picture.
Okay. So what can owners expect during recovery? How long does it usually take? And are there lingering problems?
Well, close monitoring is key in the hospital. Checking blood pressure, heart rate, watching urine color for signs of myoglobin. Basically making sure they're stable.
And afterwards?
Afterwards, again, prevention is the biggest thing. Making absolutely sure all medications are stored securely. In terms of complications, the main concerns in severe cases are kidney failure from that myoglobinuria.
Right.
And a serious clotting problem called DIC, disseminated intravascular coagulation, which can happen secondary to severe hyperthermia, that really high body temperature.
Scary possibilities.
Yeah.
But what's the usual outcome with prompt treatment?
You know, thankfully, with good prompt veterinary care, the prognosis is generally pretty good for most pets. We often see significant improvement within 12 to 24 hours.
That's encouraging.
It is. Now, the prognosis becomes more guarded, more serious if the animal comes in with really severe uncontrolled seizures or extremely high body temperatures. Those are tougher cases.
And the blindness you mentioned, is that permanent?
Fortunately, if blindness does occur, it's almost always temporary. Vision typically returns as the drug wears off and the pet recovers.
Okay, that's very good to know. So, wrapping this up, the main takeaway seems clear. SSRIs and SNRIs, while vital for human health, can be really dangerous for pets if ingested.
Absolutely. Secure storage, being careful if you do have to give these meds to a pet under veterinary guidance, and knowing about those potential drug interactions, those are the key things.
It really drives home the need for vigilance.
It does. And it makes you wonder, considering how incredibly common these specific medications are in so many homes, what other things we might think are harmless, could pose unexpected risks to our pets? And what more can we all be doing proactively to keep them safe?
That's a great question to leave our listeners with, something definitely worth thinking about.